Hi, Wendy Dabrusin, certified divorce lending professional with the Divorce Lending Association and Benchmark Mortgage. And today I have the pleasure of having Monica McKitterick with Impact Family Wellness. And Monica, tell us a little bit about your practice and who you are and what you do and how long you've been in practice.
Sure, absolutely. Well, thank you so much for having me here today, Wendy. So as you said, my name is Monica. I'm a family nurse practitioner, and I own a direct primary care office in Cedar Park, Texas called Impact Family Wellness. Many are not familiar with what direct primary care is. It's a growing movement of healthcare across the country that provides more affordable, personalized care by cutting out the middleman, aka the insurance company, out of healthcare, but making it affordable. So I have been a nurse practitioner for over 15 years now. I've been doing the direct model for a little over 4 years. So I spent a solid 10 plus years in that insurance-based system, treating my patients like cattle, and I was done with it. And so now I have the honor of actually taking care of human beings every day, which is what I get to do. And it puts a smile on my face every day. So yeah, that's kind of me in a nutshell.
That's awesome. So good to hear that people, who may not be able to afford insurance can have some type of health care provided to them. How would your practice benefit someone in a divorce situation?
Sure. So there's really two angles that we get the divorcee area from, and I'm a personal past divorcee, and I'll never do it again. And so it's a terrible time in life. Obviously you get past it and then the world gets better. But we definitely understand that. So really the two ways we help is one, oftentimes when there's a divorce, one person was likely providing the health insurance for the family. And so one of the spouses is typically left without. Now, if they're employed and they can get their own insurance through someone else, great. But oftentimes we get a lot of, specifically the wives, who were on their husband's insurance and they were a stay-at-home mom taking care of the kids, and now they have nothing, right? So the kids are still insured under dad, but mom now has nothing in terms of healthcare. And so that's where our practice comes into play. We are membership based, so like Netflix for your doctor, or affordable concierge is the best way to put it. And so for just $75 to $95 a month, we can provide all of the primary and urgent care that mom now needs. And, it might be for just a short time. Typically they come and they stay forever, even if they do end up with traditional health insurance. But that mom needs that coverage, right? She's going through this giant change and still needs her prescription medications, or just needs somebody to talk to. And also, as we go through this divorce, there's a lot of mental health aspect to it. The unknown, the scariness of it, the sadness, there's so many emotions that go into divorce. So even for our patients who have already been members of our office and then go through the divorce, or haven't been members, they come to us for that mental health care side of it. We are not therapists here in the office. We are staffed 100% by family nurse practitioners. So we do a lot of the medication management of that, but we also just spend a lot of time with our patients to understand what's going on. So we talk everything from depression, anxiety, sleep, all their struggles. And, there's a lot of men specifically after a divorce that struggle from a sexual side, because they just can't get out of their own head, right? They may have been with the same woman for, 15 years, and now they're with their new person and they're like, I can't perform. And it's not a physiologic problem. It's a mental problem, but there are some things we can do to help them get over that. And so I'd say those are the biggest ways that we have seen divorcee situations and been able to help them through that time.
I remember, that brings up a good question. If they're splitting up, say the husband had the kids on the policy, the court order decree settlement agreement states that, he has to have them insured. So I know that we had talked prior about even having this as a supplement in case of, maybe your insurance isn't good or something like that. So kind of expand on that.
Sure, absolutely. So most insurance plans were not purchased or made with the patient in mind. They are purchased with cost and the employer in mind, typically. And so a lot of those insurance plans don't cover much of anything. They can be highly just catastrophic. And so those everyday things like strep throat and your kid has an ear infection or just isn't feeling well and needs to come see somebody just to make sure everything's fine, none of that is oftentimes covered. And so that's where we can be used as that supplement, especially if there's not a lot of great communication between the husband and now ex-wife, that the mom may not even know what insurance coverage they have. And so they oftentimes will keep us just so they don't have to deal with that, right? They don't have to deal with knowing who's on their insurance. Did they change the insurance? So now they can't see their old pediatrician. And so instead they just bring their kids to us because they know they won't get any hidden bills and extra cost on top of it. You know, we don't charge copays. You can come in as many times as you need. There's no extra fees. And so it's oftentimes just that peace of mind for those moms, especially. I think one of the best things we do here is get rid of mom guilt because it's a real thing. And so we're able to help them through that aspect.
Yeah, that's awesome. So as far as that brought up a good point when, you know, like if my ex had my kids on his insurance per the court order and I took them to the doctor, you know, I'm going to be the responsible one paying, right? So I might get, you know, I don't know if he lets it lapse or whatever, I might get a bill for that, or I may not even get anything and don't know what is even going on. So it's important to have that, I think, that supplement in there just for your own peace of mind, right?
Yeah, absolutely. And I mean, I would say at least half of our patients here in our current practice do have health insurance that will cover things, but getting in to see somebody is a struggle, not knowing what your copays are. If you have a high deductible plan, you're going to pay out of pocket for, you know, the first $7,000.
Yeah.
And so that can be very anxiety riding and nerve wracking. And so I think that's a big reason people come to us is because it's all price transparent. You know, up front exactly what you're going to pay, which is not a novel idea, by the way, but for some reason in healthcare, we think we can get away with not telling people how much something costs. Right?
Yeah.
If you went to Starbucks and tried to order a coffee and they would not tell you the cost, would you buy the coffee? No. And for some reason in healthcare, when it comes to taking care of your own body, you no longer have choices and no longer know what the cost is going to be. You just have to deal with it. And so it's a disaster out there. And so we do our best to make sure our patients don't ever get that inside or outside of our office.
Yeah. So primary care, that would include, and I know we also talked about, you do a lot of telehealth, right?
Yeah.
So like Zoom appointments type of things.
Absolutely. Yeah. So it includes your annual physical as well as your annual physical lab work. There's no extra cost for that. It includes any sick visits, all chronic follow-ups. And we do probably 70% of what we do via text message. Especially moms, they know what's going on with their kids, right? There's a time where we need to do a strep test. We need to bring them in, look at their ears. But oftentimes moms are like, hey, my kid's got this thing. This is how we fixed it last time. And we build those relationships with our patients so we know exactly who they are. And it's like, oh yeah, it's Johnny with his typical sinus infection that he gets every 3 months or every spring. And so we don't necessarily have to lay hands on those kids and take the time away from the mom from going to work or getting kids from school or, you know, those sorts of things. And so, yeah, we handle a lot via text message and telehealth. There's not a ton of reasons I have to actually touch someone. You know, there's a time and a place for that, but we do our best to make it reasonable and what it needs to be instead of bringing patients in for every visit, because that's just a waste of your time.
Yeah. And you do like OB visits?
Absolutely. Yeah. So, I mean, and by OB, I mean GYN. We do not do babies.
Right.
So we don't do pregnancy follow-ups. We don't monitor pregnancies, but we do the GYN side of it. So we do pap smears, we do vaginal swabs, we do pelvic exams, we put in IUDs, we do all the birth control. And we also do hormones for both females and males.
Okay. And then, so what is it that you would not, like if someone came in, and what is some type of situation where you would refer them out?
Sure. So one of the big things we see a lot of these days is diagnosis of ADD and ADHD. That requires a psychiatrist, and we are not psychiatrists. We can manage those medications. If you've been diagnosed and you're on it and you're stable, cool, we're your people. We can fix that. We can take care of that for you. But if this is a new thing of, I think my kid has ADD, or I as an adult think I have ADD, we will send you out to a specialist. Now, for other things, there's a time and a place for a specialist, and we do our best to try to reduce just using specialists all the time. We do have a consulting service here that is free to all of our patients. So if a patient, just this morning, I have a diabetic and he's got some weird things and we really need to consult with an endocrinologist. So instead of sending him to one, I just typed up a synopsis, sent it off to an endocrinologist, and I got an answer 3 hours later of what the next test is that we should run. There is a time and a place where we have to send people to surgeons or that sort of thing. But we do our best to keep our patients in our office as long as we can. But we do know when to pull the cord and say, sorry, that's over my pay grade. You need to go see a specialist.
And so you're not a drop-in clinic or anything like that?
No, we don't do drop-in appointments. However, we do offer all of our members, they can do same-day scheduling online. And if they can't find an appointment, or, hey, the school nurse just called me and said, my kid has a fever, can I bring them over? Absolutely. Like, we will squeeze them in. It's pretty rare that you can't get a same-day appointment here, especially for something urgent. Now, if you've had an issue for 7 years and you call me at 3 o'clock, you're like, I need to be seen today. Sorry, that's probably not going to happen. But especially for those urgent things, for those little ones, like, the last thing we need is everybody to be awake all night long because little Johnny is screaming because he has an ear infection, right? So yes, we typically can get people in same day, but we do require an appointment.
So how many practitioners do you have in your office?
Sure. So there's myself and then 2 other NPs right now. We are bringing on a 4th NP to this location in July. And then we do have a Liberty Hill location. It's currently closed because we don't have a provider up there, but as soon as we can find the right provider, so if anybody knows a nurse practitioner looking for an amazing career, please let me know. So as soon as we get that provider up there, we will also have that location open. So hopefully this summer there will be 5 of us.
Okay. And then can you go a little bit more in detail on the cost of it?
Sure, absolutely. So for adults under the age of 50, it's $75 a month. Adults over the age of 50 is $95 a month. Kids are $45 a month. We do have a single parent option. So 1 adult and 2 kids, regardless of the adult's age, is $145 a month. And then a family with 2 adults and 2 kids is $225 a month, I believe. Yes. And then you can add additional children for $30 a month. And all of that pricing is very transparent. It's on our website, impactfamilywellness.com. We don't require contracts. We don't have any enrollment fees. We do require first and last month up front because we require a 30-day notice to cancel. So your first month will be double. And then every month after that is half of that. So.
Okay. And then, so if someone, like today, someone decided that, they're not feeling well, they really need to see someone, but they don't have insurance, can they just call you and go in today if you have availability?
Yeah. So ideally our new patient appointments are about 60 minutes, but if somebody's not feeling well, you don't want to spend 60 minutes at our office. So we could get them registered and bring them in for just an acute appointment to deal with what they're dealing with that day. And then we would set up another time to talk to them more in depth about all of their history and how to keep them living their best life. But typically, yes, we have same day appointments available even for new patients.
Yeah, that's awesome. So is there anything, this podcast is nationwide. So you are located in Cedar Park, Liberty Hill, Texas.
Correct.
I know there's probably your type of practices throughout the nation. So what would someone look for when selecting a direct care provider?
Sure. So the best way to find them all is to go to a website called dpcmapper.com, and that will give you an interactive map of all of the direct primary care offices across the country. And then you need to find not only one that's close to you, but also that you fit their personality. So the best thing about direct primary care is it gives you the choice to pick your provider, right? Yeah. You don't have to just be told who you have to see anymore. So you really need to find somebody that fits your personality and also your take on healthcare, right? If you are more of an Eastern medicine person and you find a full-on Western medicine person that just wants to prescribe pills to you all the time, that is not going to be a good fit. So if you're kind of in the middle, you want to find that middle person. And most direct primary care offices will offer a free meet and greet with your provider, so that you can have a conversation with them, so that you can kind of get a feel for if your personalities meet. Like I tend to be a little more sarcastic and direct with my patients, where some of my providers are really sweet and soft, and they're so nice, like nice to a fault at times. I'm like, what are you doing? That patient needs to be told what to do. So you kind of have to find that personality that mixes with you. And I think that's one of the beauties of DPC is you get the choice. You get to choose who you see on a regular basis. And if you don't like them, you leave and you go find a new one. The number of people that complain about their primary care provider and that they don't listen and they don't know who they are, that's not what direct primary care is about. So finding that location that fits your needs, but also has the provider that fits your wants and your opinions on your healthcare, right? It's your body. You get to pick how you treat it. And there should not be a provider out there that dictates otherwise, right? Like there's a time and a place for a pill, but I think we overuse them a bit in this country. And so finding that person that fits your level of how you like to take care of your body, I think is really important.
Yeah. And so you personally try to find more of a holistic approach prior to just getting medications?
Yes, I think we always need to look for the underlying issue. Sometimes that's genetics and I can't fix that, right? But I think the most important thing for me is what my patient wants, because I can tell a patient till I'm blue in the face that they need to do X, Y, or Z. But if they aren't on board with that, they aren't going to comply, and therefore nobody's winning, right? So I have to find something that not only my patient is on board with, but that I also agree with. And most of the time we can find those middle grounds, right? And so I'm not functionally trained, so I don't do like peptides and that sort of thing, but there are definitely supplement options out there. And there are things that we can do that aren't a pill, but there's also a time and a place for a pill. This is why I went to school for 9 years, right? So, but that's why I'm here, is to coach you through that so that we can understand what works for you, what works for your body, and what is a safe option.
Yeah. Well, this is all great information. I'm so glad that you're here and, have options for people who don't want to spend hundreds of dollars a month on insurance, can afford it, or just don't have the resources for individual insurance. So this is great. So where can someone find you if they're looking, if they're wanting to find more about your practice?
Absolutely. So impactfamilywellness.com is our website. It has all of our info, all of our contact information, our phone numbers on there that you can call or text, and you'll get directly to the office. You can email me directly at monica@impactfamilywellness.com. We're on all the social platforms at impactfamilywellness.com, or just Impact Family Wellness, I guess. So yeah, we try to make a lot of educational information out there on those platforms. But yeah, those are the best ways to find us.
Awesome. Well, I appreciate you being on. Any final thoughts you want to share with us today?
No, I just really appreciate you allowing me to speak on this topic. It's a growing model of healthcare across this country that I really do feel very passionate about, obviously. And I think it's going to allow Americans in general to get better healthcare again, because unfortunately our healthcare system is really broken. And so to anybody who's going through a divorce, I feel you. There's a light at the end of the tunnel, my friend. You will get past it. And we're here to help. So thank you again, Wendy, for having me today.
Thank you so much, Monica McKitterick, Impact Family Wellness.